Hi everyone, it is time for part 2 of our talk about liposuction. And what I wanted to cover in this part was simply a little bit about the procedure. And basically what you need to understand is that liposuction is a surgical procedure. We do make tiny incisions as part of the procedure, and you can call them perforations or punctures or use some other euphemism for a small incision. But in order to do the procedure, every single liposuction case has to have a small incision. So through that small incision, we infiltrate and introduce some fluid. That fluid contains medications typically that help prevent bruising. They also will improve the postoperative pain, but then also help to enlarge and swell the area during surgery so as to facilitate removal of the fat, which is obviously the next step after doing that infusion of the fluid, is that we will insert tubes, cannulas if you will, to evacuate the fat. It's just a simple process of evacuating fat with a tube. It's an interesting thing that through the years there have been a large number of different liposuction devices that have been introduced. And in order to attempt to sell those devices, many manufacturers have touted the superiority of these particular different types of liposuction equipment. But it really turns out that when we look at the studies, and certainly as we talk amongst ourselves, the differences in the final results really aren't there. And for the most part, you really are dealing with a technique that is much more dependent upon the person performing the procedure. It very much is like handing a paintbrush to a true artist or handing a paintbrush to a 3-year-old. You're going to get a completely different product, and it has nothing to do with the tool. So it really is more about the experience and the expertise of the person who's doing the treatment than it is the machinery and the technology. So that said, really what you're looking for is an expert and someone who's experienced in doing this, and kind of go for the person, not the technology. The last part of the procedure is a blending and a smoothing technique. And I use a technique that really does help break up these channels and these tunnels that liposuction creates so that it enhances the smoothness of the final result. So that happens, we close everything up, and then you're put into typically, not always, but typically some compression tool, such as a binder, an abdominal binder, a Velcro suit of some sort, just simply to help put some pressure on things. The next part we're going to go over next is going to be the recovery. And during that recovery discussion, we'll talk a bit about what to expect during those few days afterwards. So hope this has helped and it makes sense, and we do appreciate your time in listening. Thank you.